What the world has endured this past year has been unparalleled. COVID-19 created situations that the modern world has never seen before. Frontline healthcare workers, doctors, nurses, ER staff, elderly care and nursing facilities were thrust onto the battlefield to fight an invisible foe with no treatment or cure. These dedicated warriors actively risked their own life to care for the well-being of others. Knowing their own health was in jeopardy, they sacrificed the unimaginable while facing the unknown. As we move past the anniversary of our country's lockdown, and as states begin to lessen restrictions on gatherings, PPE protocol begins to change, and the vaccines are being administered, the battle is not over. Frontline healthcare workers are still battling the coronavirus, and the threat still remains. Onco 360 is a family, and that family stretches far past our staff, our patients, and our provider offices. Many of our employees have family members that are among the 18 million frontline healthcare workers in the U.S. They have endured the struggles, fear, and anxiety as they have fought this pandemic. Here is their story.
Well, my name is Emily Britt. I'm a nurse practitioner in Virginia, and I've been in the medical healthcare field since I graduated as a registered nurse in 2010. I've been a nurse practitioner now for almost 5 years, mainly currently in oncology, hematology.
So my name is Caitlin Owens. I have my BSN, which is my Bachelor's of Science in Nursing, and I'm a registered nurse. I graduated in May 2015 in Pittsburgh, and I work in the Philadelphia area. I've been in emergency medicine since August 2018. So about 2.5 years I've been in the ER and working in COVID land for 1 year plus.
My name is Jim Britt. I'm executive director at an assisted living community in Kentucky. I also serve on the board of directors for the Kentucky Senior Living Association, representing all of the assisted living communities in Kentucky.
These three different perspectives provide us insight into the feelings that they dealt with and how their patients reacted to COVID-19.
I was scared. I knew that I was going to be considered quote unquote essential, given that I did work in the healthcare field. And of course, people need cancer treatment, whether there's a pandemic or not. So that was going to continue as planned. So I knew I would need to show up to work every day and I would need to be there. Of course, that's scary when in the midst of something that's new like that. And you hear that everybody else is at home and on lockdown, but you don't get to do that. But of course, that's what you sign up for as a healthcare provider.
So. Because obviously they knew that that's where the virus was in the hospitals. People with the virus were in the hospitals. So our numbers were strikingly low. So if you were coming in, you were sick.
Nearly everybody was very grateful for the precautions that we were taking. Unfortunately, a lot of residents were isolated or even quarantined to their rooms at times. And because of that, they were just watching a lot of TV, watching the news. So there was obviously a considerable amount of fear, concern about what was happening outside of these walls. But I do think that the primary emotion, as I think about it, was probably fear. And even though the residents that we serve, the population that we serve, are an incredibly resilient and tough bunch of people. They've lived through World War II, most of them, and the Great Depression and any number of other challenges since then. At the same time, this is a new thing. They're isolated. They're seeing all this information on TV, and there was a lot of fear for sure.
The change came in when we had to start improvising. I know in New York, there were these images that circulated of nursing and healthcare professionals wearing trash bags because they didn't have any gowns or any PPE. So in that regard, it was very different, having to improvise and reuse your mask for shifts and shifts on end, and having to get it cleaned and in between shifts because you were only issued like one N95 respirator. So in terms of the supplies that we had and the improvisation that we had to use to protect ourselves was quite different.
We all began to feel the pressure and the weight of protecting our residents and keeping our building COVID free. After 12 years of military service, I think I operate pretty well under pressure, but really this was a new pressure. We've got 100 residents here, and they all have families. We've got about 50 staff. Of course, they all have families. So I really started to feel the pressure at some point for protecting all of these people in this building, including my own family, of course.
The frightening part of that is what are you going to bring home, and how could that affect your kiddos, your spouse, things, other people that live with you. So that was a huge concern, not knowing if I'm potentially endangering them. So I literally changed my shoes. I only wore one dedicated pair of shoes to work every single day, and I wiped them down every day before I brought them back in, put them in a bag, and they never saw the light of day except at work.
The emotional impact was heavy on everyone during the early days of COVID. The two groups that were affected the most were those infected with the virus and those in the healthcare industry caring for them.
Working with oncology patients, of those on active treatment, are immunocompromised to some degree. So it was very scary emotionally for them, for sure.
For us, when one tested positive, 20 tested positive, and 8 staff, or heck, it might have been 12 staff. And, it created, if there was fear before, it created a lot more fear. And we were wanting to we had prepared our staff to pivot to some degree to like work in other departments, to care for people. And there were a couple of instances where, people were understandably scared to expose themselves to residents who had tested positive. And many of them were getting pressure from their families as well. You don't need to be there. And so we had people leave. We had staff members leave.
I know that a lot of people put their, people with chronic conditions, cancer, kidney transplant patients, et cetera, put their health kind of on the back burner a little bit. And, I mentioned that the ERs were empty, but people who normally would have come in were not coming in. So all of these chronically sick patients, I think, were relying on just talking to their doctor over the phone rather than being seen in person, which potentially could have put a little bit of a further damper on their health as well.
Biggest concern, honestly, the first thing that came to my mind when things started shutting down was, from my point of view in oncology, how many potentially cancers could have gone undetected because screening mammograms or screening colonoscopies or things like that just were not being done, whether that's fear of on the patient's perspective and wanting to postpone things, or whether or not the hospitals were even doing them at all. So that was one of the first thoughts I had. That was quite unnerving.
We always in the ER have death from pretty different reasons over the years, heart attack, stroke, et cetera. But this was something that I think family members had to deal with the guilt as well of this could have been prevented by us locking down a bit more, doing different things like that.
The majority of our staff hung in there, went above and beyond, set their own fears and concerns aside to help serve and take care of the residents that we have here. And it was inspirational and very courageous.
The very first patient that I lost due to coronavirus, and I had just seen him a month or two prior, and I remember thinking, man, this is real. This is real, because he was very healthy, and remember thinking that this seems to take no prisoners. So I'm blessed in that Personally, I've had no family or friends that have lost their lives, but I certainly know plenty of people that do have family members that have lost their lives. And of course, it's awful to think of people having to spend their last few moments of life alone and family not being able to be there with them during that time. It's incredibly painful. And we, it is a disservice to those that we have lost to not, throw that out there and speak about that, because typically people are able to have loved ones at the last few moments of their life. So my heart goes out there to all the people that have been lost and all those that have lost loved ones themselves, because it's extremely painful.
Once family members were kind of started allowed, it was like one family member would be allowed to come into the bedside with imminent death. Pretty much we were allowing one person to come in, and just seeing them completely break down, fall on their knees in the middle of the ER and like start crying and just being so inconsolable. And part of it was understanding that they were losing a family member, and part of it was just this like inherent guilt, because they were like, I could have given them COVID. I was out. I had a friend over and then they got it, so it's like, people backpedaling and then being like, oh, I never thought it would happen to me.
In 2021, we are still battling the pandemic. Even though the vaccine is in the progress of being administered for the healthcare industry, the threat of COVID is still real and has not changed. After a full year, we talked to Onco 360's family members who are frontline healthcare workers to see how they are doing.
The joy that having children around brings our residents is significant. They just, there's just an added element to an activity, to a gathering, to a function with small children around. It brings a great deal of, lightheartedness and a festive environment when we've got kids around. And the kids really respond well to the population we have here. It's like having a room full of 75 or 100 grandmothers. So we've really missed out on that. Our residents have missed out on it. Our kids have missed out on it, and we've all missed out on seeing that interaction.
The coronavirus is absolutely still a concern. I feel like there is a light at the end of the tunnel now that the vaccine is out, and I'm seeing more and more people that have received them and have done well. So I am praying that we're on the way, on the road to recovery and to get somewhat back to a normalcy. But it's again, absolutely still a concern, because I actually have a colleague that became infected even despite being fully vaccinated.
Your duty to return to normalcy. I don't know if we'll ever go back to like a pre-COVID state necessarily, but just, the light at the end of the tunnel, the vaccines are really ushering us there. So, I think we have more PPE, it's more routine. I think people are kind of falling into a routine, a bit more of something that could be realistically for months, years to come now, like the new normal, as we've been hearing it called.
Over the past 12 to 14 months, over 3,600 frontline healthcare workers have lost their lives due to COVID-19. The entire Onco 360 staff and their families send our thoughts and prayers to the families who have lost loved ones to the coronavirus. To continue their legacy, Onco 360 has made a donation in the amount of $10,000 to the Frontline Families Fund. The Frontline Families Fund provides direct financial support and educational scholarships to the families of healthcare workers who have lost their lives to COVID-19. At Onco 360, we appreciate that they were there for us, and this is a way for us to be there for them. For more information about the Frontline Families Fund, here is a word from the founder, Dr. Michael Osterholm.
Hi, I'm Dr. Michael Osterholm, Regents Professor and Director of the Center for Infectious Disease Research and Policy at the University of Minnesota. I, like many others in the front lines of public health, have spent the past 14 plus months immersed in the issues surrounding COVID-19. Many of these very painful, very difficult issues when we understand the extent to which this pandemic has taken the lives of loved ones, family, friends, colleagues. CIDRAP, the Center for Infectious Disease Research and Policy, recognized early on the challenges that we have with healthcare workers, using that broad definition of all those who make it possible for us to have care, whether it be in hospitals, long-term care facilities, medical clinics. Really, we're on the front lines of COVID-19 from the very first days. Unfortunately, more than 3,600 of these healthcare workers have died in the course of this pandemic. This fund will provide the financial support to those families of healthcare workers, whoever they may be, whether they're doctors, nurses, nursing assistants, environmental sanitation workers, station clerks, transportation attendants, anyone who has played a role in making certain that we are able to obtain the health care we need during this COVID crisis are taken care of should they themselves develop COVID-19 and die. Today, we are providing immediate financial support for those families who have that need. Oftentimes, those who are in the areas of environmental services, those who work as station clerks, any number of different positions are not the high-paid healthcare worker jobs that you might think of. These are people who live like many of us from paycheck to paycheck. These are people who are concerned every day about can they meet the rent? Will they have enough food on the table for their children? This fund was established to help those healthcare workers who have given so much to us. And I'm very, very honored and pleased to say that Onco 360 has been a key partner in providing that kind of support on behalf of its workers and on behalf of all of its customers, clients, and affiliated individuals. So thank you to you at Onco 360 for recognizing the importance of this effort and for making certain that your employees are well represented in supporting the efforts that we today are moving forward to honor those healthcare workers' families who have given the ultimate sacrifice. Thank you.